Hi, my name is Christina, and my population health project is on the healthcare of homeless women in the United States. Homelessness means sleeping outside, in a shelter, or in transitional housing programs. Women and children are the fastest growing community in the homeless population, with 34% of the total homeless population composed of families. 84% of homeless families are headed by women. Some risks of becoming homeless are the lack of affordable homes, unemployment, job loss, foreclosures, personal or family crisis, reduction in public health benefits, mental illness, and violence. Health behaviors for homeless women. These are all negative behaviors. Health improvement, housing case management, health restoration, follow-up care, lack of referral to service, health maintenance, denial of problems, medical providers, and lack of treatment centers. There's a lack of inpatient discharge planning and follow-up care, in addition to a lack of referral to service available within the community for the homeless individuals. By providing housing and case management for those with chronic illnesses and conditions, it will help to improve health by reducing the number of days homeless people spend in hospitals. The socioeconomic status of homeless women, specifically poor health. 57% of homeless individuals lack a regular source of health care, compared with 24% of poor individuals and 19% of the general population. Factors that contribute to poor health care in homeless women are a lack of insurance, long waits at medical facilities, inability to buy or receive medication, the lack of knowledge of where to get health care, lack of transportation, and a lack of education. 53% of homeless mothers lack a high school diploma. And lastly, poverty. A lack of affordable homes, making those who are not extremely poor homeless. Finding resources for food, clothing, and shelter takes precedence over meeting healthcare needs. Women spend their days collecting food, making clothing, and building a shelter, rather than waiting in medical facilities to get their healthcare needs met. Health issues for homeless women. They have a lack of access to healthcare, including prenatal care, mammograms, and Pap tests. They're at a high rate for poor health status, mental illness, poor birth outcomes and mortality, and they are affected by chronic illnesses such as asthma, anemia, chronic bronchitis, hypertension, and ulcers. Approximately one-third of medical problems treated at locations that provide healthcare for the homeless population are considered chronic illnesses. Detriments of health. Domestic and sexual violence. 22 to 57% of homeless women report that domestic violence was the immediate cause of their homelessness. Women run away from their violent homes to keep themselves safe, and unfortunately this is the leading cause of homelessness, because these women don't have anywhere to go and the few domestic violence shelters around are typically full. This leads the women at a higher rate for rape. Rape causes unintentional pregnancies, the need for treatment for injuries caused by rape, as well as medication and treatment for prevention for STIs. Prevalent health issues for homeless women. Poor birth outcomes and mortality. Homeless women are experiencing these high rates of poor birth outcomes because of the lack of access they have to health care. Homeless women have higher number of adverse birth outcomes when compared with the general population, such as preterm delivery, putting them at 2.9 times more likely. Having a baby weighing less than 2,000 grams is 6.9 times more likely. And having newborns that are small for their gestational age is 3.3 times more likely. In the United States, preterm birth rates and low birth weights in homeless women exceed the national average. This community is particularly affected because these women do not have access to healthy foods, vitamins, and prenatal care. If they had the access to these few things, it might reduce the rate of preterm delivery, low birth weights, and their babies would be bigger for their gestational age. Future trends. There are efforts to improve the health of the homeless, especially the homeless of women, by encouraging healthcare providers to treat the homeless without being biased and without withholding treatment. They're to treat them just like they would with any other patient. There are efforts to provide transportation, as well as providing healthcare services at shelters via healthcare volunteers. Improving the health of homeless women is done by increased fundings, donations of medications, as well as feminine products. These products are expensive items that homeless women cannot afford and they have to improvise, which causes more health issues. Providers are to be more aware of patients who are at risk of becoming homeless, and if they think the patient is a victim of domestic abuse, they need to report it and get help for their patient. This will prevent a large number of women from being homeless. A suggested strategy I find to be very important would be providing more shelters for the domestic abuse situations, since this is the leading cause of homelessness in women.